Let's do digital unboxing of my new book for psychiatry postgraduate resident, A Handbook of Child Psychiatry, launched recently at mid-year conference of Indian Psychiatric Society. So I am teaching psychiatry postgraduates for last 6 years, and the first module I started was module number 1, child psychiatry, because in child psychiatry I wanted to go beyond ADHD and ASD, because most of the residents were not reading about intellectual disability properly, communication disorder, elimination disorders, those areas in psychiatry, child psychiatry, which are mentioned in the textbooks, but we don't get to see that many cases. And if we don't read them, we can't comprehend them properly. So I went through child psychiatry books and prepared some lectures. These lectures are available on DAMS Alpha app, and some of them are available on my YouTube channel. So I came up with this idea of going through with this book, and I'm very thankful to Dr. Rao sir, who has written a very beautiful foreword for me. In this book, it is not only by me, it is co-authored by my friend child psychiatrist from UK, Dr. Pulkit Kaushal, who has given a insight into the chapter of latest development in autism spectrum disorders, and Dr. Ribhav Gupta, who has been the whole soul in editing, printing, typing. Everything has been done by my co-author, Dr. Ribhav Gupta. So I just want you to tell what this book has for you. So these are my lectures which I have taken for the resident. Intellectual disability, disruptive mood dysregulation disorder, ADHD. I have taught ADHD 4 hours. 2 hours theoretical portion, 2 hours practical and management. Communication disorder, autism spectrum disorder, early onset schizophrenia, SLD, proper dyslexia diagnosis training, special education module, DMDD, disruptive mood dysregulation disorder separate, disruptive behavioral disorder, ODD, CD, motor disorders of the childhood separately, and enuresis, encoparesis, childhood depression, latest guideline, childhood OCD, whatever, attachment disorder with a little touch to the attachment theory, and Piaget and Erikson theories. Let me give you a quick look at what are these notes. So when you have to read intellectual disability from textbooks, you have to remember certain basic points, like most common presentation of mental retardation has to be a behavioral abnormality with which presents to us. How do you deal with that behavioral abnormality? How do you categorize intellectual disability? Proper charts, proper cognitive function assessment, adaptive functioning. It has from DSM criterias to degree of severity. This chart was made by me. How to clinically find out mild, moderate, severe based on degree of severity comparison, till what standard mild can study, till what standard moderate can study, severe, profound. Then a little bit about etiopathogenesis. So this is how the book flows. Just have a look at the book and you will understand the effort put in making up, because this was not written as a book. This was my notes of my lectures. So when I was teaching, I was writing everything. You can check out the lectures on YouTube or DAMS Alpha app. I was writing everything, but handwriting being not that comprehensible, so I had to manuscript entire notes of these lectures. So it is compilation of my lectures. These are our IQ testing. Have a look at some other chapter. Let's have a look at DMDD, disruptive mood dysregulation disorder. So if a 10 marks question come in DNB psychiatry exam, not only MD psychiatry, DNB psychiatry plus child psychiatry PDF entrance, child psychiatry DM entrance, plus NEET super speciality MCQs, many things you can cover up from here. I have seen few MCQs asked on difference between BPAD, DMDD, how do you differentiate ODD from DMDD, IED from DMDD, the differential diagnosis. Then ADHD, I have put a lot of effort because I have gone, ADHD is my area of interest. So I have gone to the level of explaining the biology. This lecture is also available on YouTube. The neuronal firing, every essential diagram. So ADHD, we have gone in little more details because it is required for us. So when we talk about ADHD, we need to know the guidelines, we know the prescribing. So it is also useful for practicing psychiatrists who are looking for some guidelines in refreshing their guidelines, and some clinicians who are just looking for some quick reference at whatever is coming up, whatever has been there, the protocols. So it's a very small, tiny 100 pages book. So I have added some bonus pages from some manuals as well, that what are the assessment criteria for ADHD, how, what questions to ask in adult ADHD, what questions to ask. So you will find it useful. I'm telling you, and it's not a promotional video about the book because we are not selling this book. This book is not for commercial purposes. It is for free distribution by Concerned Pharmaceuticals, who have printed the manuscript, and these are notes. We have not published it officially. We have just printed the notes. It is not for sale. It is for the free distribution, for knowledge enhancement, for psychiatrists, psychiatry postgraduate residents, and consultants. Okay, it is for those students who have already taken psychiatry postgraduate course. What they can do, they can open the video and keep these notes aside, because these are the notes of the video. I've used some Kaplan tables as well, because as I mentioned, it is not a textbook, it is notes. It is ready to refer notes. And as I was talking about autism is given in too much details, and this autism chapter we have added all the neurobiology, the neuronal firing, the mu neurons concept, mu waves concept, and the most latest thing added in this chapter is a special chapter by Dr. Pulkit Kaushal, Management and Treatment of Autism Spectrum Disorder, the latest concepts which he has recorded this year itself. It is the 2026 add-on to our child psychiatry series of lectures. Okay, so this video was entirely about to tell you what this book has, what this book contains, the colorful diagrams, and I am sure that this is useful for postgraduate students who are willing to learn learning disability. What are they supposed to write in the exam if a question comes on SLD? What are they supposed to write if a question comes? How are they supposed to approach a patient of LD? What is psychiatrist's role in LD? When to refer to special educator? What are your expectations from special educator? Because child psychiatry has been my area of interest, so you miss out these small topics like developmental coordination disorders. You know about Tourette, but people miss out on chronic motor or vocal tic disorder, stereotypic movement disorders, very small and minor areas. And I have also added some clinical pearls to differentiate. I've also added some drug of choices, some with dosages, of course. For undergraduate we don't teach dosages. Childhood depression, we often encounter more patients nowadays as compared to this. So what are the different clinical feature in preschool, school, adolescent? I have put my effort in making this book. I have put my effort in, we have put this effort, not me, sorry. In attachment theory also some basics have been explained, and we will be updating it more. So thankful to Dr. Rebhav, thankful to Dr. Pulkit, and extremely thankful to Concern Pharmaceutical, so who has prepared the manuscript, or who has printed it for the distribution of this. So it's a part of my psychiatry PG course, and we are upgrading the course with many new lecture by Dr. Shitesh, Dr. Nitin, and many new contents has been added in